In this lecture, we'll be discussing personal therapy for the counselor. So I want to start by asking you a few questions. Have you sought your own therapy? If not, why not? And I encourage you to really think deeply about this question, because if you have not been to therapy and you feel like the reason you have not been to therapy is because you don't need therapy, that can suggest a bias that you may have toward people who need therapy. I personally have never met a person who could not have benefited from therapy. I think we all need to seek therapy. So if your belief is that you're not a person who needs therapy, but your clients are people who need therapy, that can suggest the type of judgment that you're putting on them, and you don't want to do that. Of course, my wish or my hope is that you will go out and seek your own therapy. But if you choose not to do that, how would you respond if a client asked you if you've been in therapy and why you had not been in therapy? You should be prepared for that question to come up and be prepared to answer it in a way that doesn't make your client feel as though that you're judging them for coming to therapy. If you have been to your own counseling, how was the experience? Did you learn anything about the type of counselor you want to be or you don't want to be? And do you think it's important for therapists to get their own therapy? The research tells us that the vast majority of mental health professionals have been in therapy. Therapists benefit from therapy in the following ways. It helps them deal with the ongoing stress of clinical work. The work that we do can be very heavy, can be very stressful, and it can also be very isolating. If you're not consulting with a colleague or under supervision, there really is nobody else that you can talk to about what goes on in your workday, and that can make you feel very distant, very isolated from others. Therapy can help enhance interpersonal skills that are essential to skillfully practicing therapy. As we've said before, there's a relationship that exists between the counselor and the therapist, and when you're in the role of exists between the therapist and the client. And when you're in the role of the client, it allows you to practice those interpersonal skills that you then can use in your own sessions with your own clients. And it offers a model of therapeutic practice. You can learn what is helpful and what is not. So the things that you want to duplicate or you want to also use that your therapist used, and the things that your therapist maybe did or did not do that you don't want to do. Now, personal therapy can also be beneficial because conducting therapy can bring up your own unresolved issues. If you have issues around relationships or abandonment, family issues, conflict, how to deal with anger, and you have a client that has similar issues, they are going to trigger and bring up your own unresolved issues. And it's very important that in order to be effective with your client, you work through your own issues in your therapy. Counseling may help you better understand how your personal issues are impacting your work. So not only are you seeking to understand your own issues, but seeking to understand how those issues affect your work with your client. Therapists who have been in therapy feel more confident and they're more in agreement with their clients on the goals of treatment. And getting your own therapy, as we have discussed, can help you avoid assuming a stance of superiority and treating your clients like they are objects to be pitied.